And if you think about the right to health, there are four cornerstones. And so if you think about availability to health, quality, accessibility, and affordability, I'll talk about each of those briefly and what I think could be a responsibility and role of a pharmaceutical company. The first two, availability and quality, I think are, from our perspective, these are the must rights. These are our obligations as a pharmaceutical company. So availability obviously comes down to our core business of making available medicines and vaccines to treat unmet medical needs. And if we just stick for a moment with HIV as an example, that's a field that we've at Merck been invested in for over 20 years. Since the epidemic was, or the virus was identified in the early 1980s. And over that 20-year time span, the result of that investment has been 4 products that are on the market. And we continue to invest. We unfortunately concluded our vaccine research last year when a vaccine we were working on was found to be ineffective, and that was a huge blow to the hundreds of employees who've been working on it and also the international community. But we're still looking at medicines, which is incredibly important given resistance and so forth in HIV. The other aspect of research which is important, especially in a human rights discussion, are medicines for disadvantaged groups. So in that area, we're very committed to working in pediatric settings and making sure that there are indications and formulations for children, which is huge given that there are 2.5 million HIV-positive children under the age of 15. We're also working with groups such as the International Partnership for Microbiocides to look at preventative measures, which would be a huge boost for women, particularly in sub-Saharan Africa, who need such measures as that. In terms of quality, this comes down to quality of product, quality of delivery, and so we're talking here about things, obviously, safety of product, monitoring side effects, providing information to the health community and consumers, also safeguarding the safety of patients who are involved in clinical trials. So again, the availability and quality, I think those are the absolute must obligations that no one would question, that any pharmaceutical company operating today must abide by in order to respect the human rights. What's a little bit more unclear is when it comes to accessibility and affordability. And again, I'll just put forth some of the steps that I believe pharmaceutical companies should take. And I can only speak for my own company. But in terms of accessibility, I think you're seeing a trend for companies to make sure that their products are registered worldwide. So not only in markets such as the U.S., in Europe where we have a market, but increasingly in least developed countries. Patenting, which is a big issue we'll talk about, I'm sure. We have a policy of not patenting our products in least developed countries, which I think is important. And finally, on affordability, comes down to the issue of price. And we could go on and on about the issue of price. There was an interesting article in, I think it was a Lancet yesterday, talking about prices of pharmaceuticals being a big barrier to health, and it was actually the markups that take place in country by wholesalers, where the markup could be up to 400%. But from our perspective, what we're doing, we've had a policy since 2001 around our HIV products in least developed countries, and those countries hardest hit by the epidemic, to provide our products at no profit pricing, and in middle income countries to make our products available at significantly reduced pricing. So we're able to still make a profit in those middle income and high income countries, but we're able to do that and in return make them available at no profit in the absolute poorest countries of the world. So clearly, the pharmaceutical industry does have a responsibility, but I'll just return to the main point I made, is that so do other players. Certainly developed countries have a responsibility to continue to invest in basic research and research organizations like the National Institutes of Health. I think importantly, developing countries have a crucial responsibility to invest in health. I think you'll find today that very few sub-Saharan African countries are actually investing the 15% that was suggested back in, I think, 2000. And I think it's also a responsibility for those middle-income countries to recognize that they can and should pay more for some of these innovations that are on the market today.